My name is Christopher Garcia. I'm a non-invasive cardiologist at Hunterdon Cardiovascular Associates. I always knew that I wanted to be a physician, and I always had a passion for cardiovascular disease because of a strong family history in my family. And as I studied in the Icahn School of Mount Sinai, I further developed that passion. I actually initially thought that I wanted to be a cardiac surgeon, but realized that my passion was in non-invasive cardiology, and so I went on to pursue that in my training. I continue to be passionate about cardiovascular disease mostly because of my interactions with my patients. There's nothing quite as satisfying as coming out of the room after having helped somebody to survive a heart attack or helping a family through a hard time when their loved one is dealing with cardiovascular disease. I particularly feel close to the patients that, like myself, have strong family history of cardiovascular disease, and helping them to get over that fear and make sure that everything's okay is one of the reasons I continue to have great passion for the field. I treat all forms of cardiovascular disease, but some of the more common diagnoses that I treat are high blood pressure or hypertension, elevated cholesterol levels or hyperlipidemia. I treat all forms of valvular heart disease, all forms of congestive heart failure, and the various forms of cardiac arrhythmia. I employ a variety of treatment modalities. I perform all non-invasive diagnostic testing in order to help patients obtain the appropriate diagnosis. I focus on lifestyle modifications, including dietary changes and lifestyle changes to prevent and improve on current states of health. I use various medications in the treatment of all cardiovascular disease. My philosophy in the care of my patients, I would have to say, is compassion. Patients want to come to somebody that is educated, but also that they feel is an old friend. I enjoy spending time with my patients and their family in the process of overcoming cardiovascular disease. I would say that one of the most important parts of being a physician is the human component of that. And so I try to keep compassion as the primary philosophy of the care of my patients.